I'm Dr. Noelle Roll, and we're going to be talking about the impact of a lupus diagnosis and the importance of facilitating support systems. So let's get started. Juana, tell me a little bit about your journey to your diagnosis of lupus.
I was diagnosed in 2009 with lupus, but I really now believe that my symptoms started way before 2009. In 2008, though, my symptoms got worse. I was having a lot of body aches. My hair was falling. It was very difficult for me to get up every morning, to the point where it was very difficult for me to even brush my hair. Early 2009, I started having even more symptoms. I was going to the doctor. I kept hearing from the doctors, "You look fine, you're okay, there's nothing wrong with you." But then I noticed that I was having rashes all over my body. They gave me shampoos for my scalp, saying, okay, it's just a shampoo that's gonna help you relieve the problems that you have on the scalp. But in April of 2009, I had what I now know it's the butterfly rash. I started with a little rash around my cheeks, then the rashes got worse to the point where my face, my cheeks were so inflamed and the pain was excruciating. I couldn't handle it. I went back to the doctor. I was told, okay, there is nothing wrong with you. Got lab work done. Everything looks fine. Why don't you use the shampoo that you're using for your scalp on your face, because it is medicated and it's gonna feel better. Of course, that didn't work. Went back to the hospital. I got topical medication, but the rash was getting worse to the point where it was getting difficult for me to even see as the rash was going up my eyes. At that time in April, my platelets were at 99. And I said, okay, so I did a little research. Of course, I got scared because there were many things that, that would cause your platelets to be low. The symptoms started getting worse. I started having really bad mouth sores, and the rash on my face kind of went away, but the body aches were getting worse. The fatigue, the headaches, the migraines, it was really bad. And I went to urgent care, and the first thing that I told the doctor after I was seen, I said, doctor, I really think something's wrong with me. I said, I've been coming to the doctor. They tell me that there's nothing wrong with me, but I don't feel well. The doctor calls me in after the second time I go to the lab. He calls me in and he said, Juana, I need to talk to you. Something is wrong with you. And I said, okay, doctor, what's wrong with me? He said, Juana, your platelets are low. He said they're at 6. The first thing that I asked him is, am I going to die? And he said, we need to admit you. And Estela said, doctor, I have a question. Does she have lupus? And the doctor turned at her and said, are you a doctor? How would you know that she has lupus? And Estela said, no, but I've been searching and looking at the symptoms, and I believe she could have lupus. And he said, yes. And that's how I was diagnosed with lupus.
Juana, thank you for sharing that story. Unfortunately, we have a lot of patients who carry those very long, emotional, stressful stories. Thank you for sharing that with us. What would you have liked to see done, and what advice would you give to the providers to help people in situations similar to what you went through?
The advice that I would give to the providers is to listen to their patients. We are there not because we just want to get a diagnosis. We're looking for answers. We're looking for help.
The one thing that from when she went to urgent care is she looks beautiful all the time. Her makeup is done. She's always wearing heels. And I think one of the reasons that they dismissed her is because she looked so fabulous. And, several times she was sent home. If she would have been sent home that day, she would have died. And I remember telling her, do not leave.
Thank you for that. So we talked a little bit about the support system and the various personnel involved in that. And key to that is going to be the provider who helps make the diagnosis, treats, and so forth. But they're also going to be a part of this support system. So in thinking about ways in which we could talk about providers providing support, there are many simple things that we can do that would make a huge difference for patients that sometimes the provider may overlook, like simply sitting with the patient at eye level and relating to the patient like we are today. When you walk into a room, yes, you have like tons of patients, and our healthcare system doesn't really allow us to spend as much time as we would like.
So you asking the patient and maybe sometimes the family member to be involved in their care, I think is so good, because it empowers the individual to not only follow up and adhere to the treatments, but also follow up with the rest of the care team, which at times would be different specialists, right? And at times it could also be the support system in the hospital with all the providers, but also the support system outside and providing the handouts, asking what is it that you need? Because a lot of times patients don't have that loved one or that support system. So providing those resources is really, really key. And I think having a support group also helps them not only navigate their care and learn from others, but also share their experiences as well.
Thank you for sharing your story. I'm sure it's going to make an impact on a lot of providers. Thank you, Juana.
Thank you.
Thank you, Estella.